Good morning. Thank you, Dr. Atik, for giving me this opportunity. Yes, so ocular surface analysis. So we have to know the ocular surface is like the skin, exposed to all wear and tear, weather, humidity, temperature, injuries, harsh chemicals. So ocular surface of the eye is also like that. It is comprised of cornea, conjunctiva, the lacrimal gland, lids, and the preocular tear film. So dry eye is defined according to its like multifactorial disease of the ocular surface, characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear instability, hyperosmolarity, ocular surface inflammation, damage, and neurosensory abnormalities play etiological. So, this multiple role, multiple factors. So, increased osmolarity of the tear film, inflammation, loss of goblet cells, damage to the surface cells, tear film instability, and excessive evaporation from the ocular surface. All this causes an ocular surface disorder. So, how do we evaluate these ocular surface? So, four main things we have to do is like ocular surface analysis occurs when the conditions alter the protection, composition, or distribution of the preocular tear film. So, you have to first assess the tear volume, tear film stability, tear film integrity, and other laboratory investigation supportive for that. So, to start with the tear volume assessment, we can do a Shimmers test 1 or Shimmers 2 with or without topical anesthesia. Anything more than 10 is normal. So, we have to grade according to mild, moderate, and dry eye according to the millimeters of tear volume. Next, tear meniscus assessment is a normal thing. We can look on the slit lamp observed in the fluorescent dye after instilling fluorescent dye. Normal height is around zero point 0.2 to 0.5. Anything less than 0.2 is significant. How do you measure the tear film integrity? You have to stain the cornea with the fluorescent or the conjunctiva with lissamine green and rose bengal. According to the rose bengal staining, the intensity and location of staining in the conjunctiva is taken into consideration and graded accordingly. According to National Eye Institute grading, the cornea, the fluorescent staining anything more than 3 and the conjunctival rose bengal staining anything more than 3 is also significant of a dry eye. We can use a Efron scaling, which according to that we can grade the ocular surface. Tear film stability. How do we measure the tear film stability? Normal by fluorescent breakup time. So it is the normally anything more than 10 seconds is normal grade. The tear film is more stable. Anything lesser than that is the tear film is unstable. There is a non-invasive tear film breakup time we can use, which can be done using a grid or a placidose disc images. How do we measure the tear integrity? Integrities can be measured by interferometry, that is the lipid layer analysis, which gives color-coded interferences. According to that, we can see the tears uniformly blue in color, which less nanometer thick thing is like a normal eye. As is the dry eye and the lipid layer thickness increases, the intensity of the color and the nanometer thickness increases from grade 1 to grade 4. Next comes the tear scope. We can assess the lipid layer thickness in order of increasing thickness and visibility, and it is great. It appears as pattern as open meshwork, tight meshwork, or waves or amorphous patterns, and there is also color coded images. We have an ocular surface which can be slit lamp mountable or a portable device which measures the lipid layer thickness, interferometry, non-invasive breakup time, tear meniscus height, mebobinography, white to white, blepharitis, demodex, and the bulbar redness, and use a constant international grading scale, and according to that define the dry eye as mild, moderate, and severe. Next, tear osmolarity. It can be tested normally using a eye pen or a normal tear osmolarity test, which is usually kept in the lower lid. With the capillary action, it absorbs the tear. And tear osmolarity, anything up 300 is milliosmoles is normal. A value greater than 300 milliosmoles is suggestive of dry eye. 300 to 320 mild, 320 to 340 moderate, and anything more than 340 is severe dry eye. The other things are confocal microscopy. It helps to detect changes in the corneal epithelium, immune system or inflammatory cells or corneal nerve damage, keratocytes, meibomian gland structure. All this can be detected at cellular level. Corneal topography can show an irregular Myers in the OST. Phenol red test to test the pH of the tear film. Aberrometry to assess higher order aberrations, which can be due to a tear film instability. Corneal aesthesiometer is also done because neurosensory mode also plays an important role in OSD. The other test which can be done is ocular protection index is the time tear film breakup time in seconds divided by the interblink intervals. So you have to know the blink ratio also, which is important in ocular surface analysis. Other things are like closed chamber infrared thermometry, which can measure the temperature in the eye by closing and opening time. It's around 0.10 centigrade. In the dry eye, there is no change in the temperature. Closed chamber humidity of the eye can also be measured in relative humidity index. As such, it is like the closed chamber applied to the eye humidity is measured with eyes closed, and then for 5 seconds, open the eye and measure. The other tests are we can use a meibomian gland imaging, measure the lipid layer thickness and the blink dynamics. So we can assess the meibomian gland according to the structure, normal gland structure or gland dropouts. We can use that to assess a meibomian scale according to the distribution of the gland, degree 0 to degree 4, according to the degree of meibomian gland loss. Johren's test is important to assess Johren's syndrome. Lactoferrin test is decreased lactoferrin in aqueous tear production. Inflammatory dry eye is helped to detect inflammatory dry eye dosage in the matrix metalloprotein 9 assay. So we can treat the OSD with the anti-inflammatory therapy. And normally an OSDA score is very helpful in the outpatient department. So we can grade as dry, moderate or severe dry eye. And other tests are tear mucin, qualitative mucus assay, lactoferrin measurement, Ferning test, conjunctival or biopsy, lacrimal salivary gland biopsy. Lots of tests, impression cytology in nasolacrimal reflex, antibodies and tear protein. So all this, the ocular surface is important because however best eye surgery we do and give a very good vision, the quality and the comfort of the patient is very important. So pre-operatively, please do a proper examination, proper history and rule out the dry eye disorder and give them a simple lubricating or preservative free eye drop, which will give them a better quality of vision.